That's a difference.
Matt, what's the gross revenue of Bain in the years you were associated with it? What's the gross revenue?
Very substantial, but I think it's irrelevant compared to the fact that you were working for Freddie Mac.
Wait a second.
You were working
very
for
substantial. Did Bain ever do any work with any company which did any work with the government like Medicare?
We didn't do any.
Medicaid?
We have congressmen who also say that you came and lobbied them in favor.
I didn't lobby
of
them.
You have congressmen who say that you came and lobbied them with regards to Medicare Part D. At the same time, your senator was taking in contributions.
You just jumped a long way over here, friend. Let me be very clear, because I understand your technique, which you used on McCain, you used on Huckabee, you used consistently, okay? It's unfortunate, and it's not going to work very well because the American people see through it. I have always publicly favored a stronger Medicare program. I wrote a book in 2002 called Saving Lives and Saving Money. I publicly favored Medicare Part D for a practical reason, and that reason is simple. The U.S. government was not prepared to give people anything, insulin, for example, but they would pay for kidney dialysis. They weren't prepared to give people Lipitor, but they pay for open heart surgery. That is a terrible way to run Medicare. I am proud of the fact, and I'll say this in Florida, I'm proud of the fact that I publicly, openly advocated Medicare Part D. It has saved lives. It's run on a free enterprise model. It also includes health savings accounts and include Medicare alternatives, which gave people choices. And I did it publicly, and it is not correct, Mitt. I'm just saying this flatly because you've been walking around this state saying things that are untrue. It is not correct to describe public citizenship, having public advocacy as lobbying.
Why it's a problem, Mr. Speaker. Here's why it's a problem. And that is, if you're getting paid by health companies, if your entities are getting paid by health companies that could benefit from a piece of legislation, and you then meet with Republican congressmen and encourage them to support that legislation, you can call it whatever you'd like. I call it influence peddling.